Healthcare Ready has really learned how to become a more nimble organization and leverage our partnerships across the public health, healthcare, and emergency management spaces. The activations from 2021 that really stand out to me include the severe winter weather that impacted Texas, Hurricane Ida during the hurricane season, and the tornado outbreak in December that hit Midwestern states.
We had some severe winter storms, especially in the Midwest, affecting Texas. Those hit actually a lot of resin plants that are critical to a lot of medical devices and whatnot, like plastics. And that actually shut off those plants for a few weeks. And honestly, we're kind of still seeing the effects of those resin plants being shut off.
The largest response was most likely the response to Hurricane Ida, which impacted the whole Southeast corridor. But I would also mention the wildfires that affected the Western United States as those flared up through the later half of the year. We were able to overcome the challenges presented by an overlap of disasters and an ongoing response to the COVID-19 pandemic, because although the impacts of these specific events differ, the process for gathering and sharing information across the healthcare and public health sector remains consistent. Although it required a lot more juggling of the topics, at the end of the day, completing a comprehensive picture of the healthcare landscape is the most important aspect of making sure we can get information and aid to where it's most needed.
Through coordinating a lot of public-private coordination, setting up a lot of meetings ad hoc. For the resin manufacturers discussion, that has actually been a prolonged discussion over the course of the year, even into this year. It was implemented into national strategies by the federal government to, focus on securing that supply chain. But then on the flip side, for the hurricanes, we saw a lot of ad hoc calls being set up between public and private sector partners, figuring out, how do we get these oxygen tanks and this oxygen to the patients that need it most.
And I think the value of Healthcare Ready truly lies in our vast network and strong partnerships. So from there, I think we know how to escalate and route these issues to the appropriate partners who can help us identify a solution and help communities who are not only responding to the disaster at hand, but are also dealing with COVID and in some cases are still recovering from the last disaster.
This new environment we're in with COVID and the pandemic, it's changed everything completely. People need to be more fluid with their preparedness plans because you have to be gauging both sides. How much can this hurricane impact us if we're also dealing with, COVID patients in a hospital or etc.
I think we really recognize the value of bidirectional information sharing to ensure that our partners have the information that they need to make strongly informed decisions as they respond to overlapping disasters.
While tracking the impacts of wildfires and tropical storms, we first of all ensured consistent and clear communication with the largest pharmacy providers across the country, allowing us to operate RxOpen, our free pharmacy finder tool, and understanding whether those pharmacies are open or closed, ensuring that it's always displaying the most up-to-date information available. Additionally, we were able to create some interactive maps showing road closures, evacuations, boil water notices, and power outages for hard-hit areas by natural disasters such as Louisiana during Hurricane Ida. Over the course of 2 years, we built our Community Disaster Resilience tool, the CDRT, which is an interactive and explorable tool to help emergency responders understand the overlap and vulnerabilities that their specific population faces.
It's a really intricate space, and I think that Healthcare Ready does an exceptional job of learning from each disaster so that we're better equipped to activate for the next event, and also maintaining our partnerships across the U.S. health system so that we do have people we can bring in to support our response. I think it's those connections, both internal with our Healthcare Ready staff, as well as external with our partners, that really help us to overcome challenges.